Diagnosis Detective explained. Woo! A new series. Follow, comment, like for more. Yesterday's video was on type 1 diabetes and DKA. A few of you were confused. Here's an explanation. Type 1 diabetes is a problem with a hormone called insulin. Now, our bodies, when we eat, absorb food into the stomach and into the bowel. Food is then dragged into the bloodstream and it goes to wherever it needs, such as the organs. Within the organs are the cells that work 24/7 and they need energy from our food. Now, when the sugar or food gets close to those cells, it can't just get into them. It needs to get through the door, and the key to open that door is insulin. Type 1 diabetics have a problem by not having enough functional insulin. So when they eat, the food goes into their stomach, into their bloodstream, so blood sugars are high, but the sugar cannot get out of the blood and into where it needs to be because that key cannot open that door, it cannot get into the cells. Therefore, the body panics. Therefore, knowing that it needs to make sugar, it can't use what's in the blood, so it breaks down fat. In doing so, it produces ketones as a waste product. This is where you get diabetic ketoacidosis. Diabetic, because the blood sugars are high, because the blood is not being absorbed into the tissues. Keto, because the ketones are now being produced. And acidosis, because ketones are acidic. As the acidity in the blood increases, the body becomes confused, dehydrated, and also patients try to get rid of carbon dioxide because that's acidic too. So patients can start to breathe really quickly. The body knows the acid levels are too high within the blood, so it gets rid of acidic carbon dioxide by breathing it out. These are the cardinal symptoms. And the breath, smelling fruity, well, ketones smell fruity. That's why you might notice it. DKA, remember, confused patient, high ketones, high sugar, fruity breath, and acidity on the blood test. Hope that helps.